Good afternoon, everyone, and I'm delighted to be here today to talk about why a human rights-based approach is required in health and social care services. We all know that human rights is protected by legislation. However, essential to ensuring that people who use our services is at the heart of service provision is a human rights-based approach. For the next 15 minutes or so, I'm going to focus on social care, and in particular residential care. But when we talk about older people, we should include everywhere that they reside or live. So therefore, I'm including centres for people with a disability, because we do know that people grow old and age in these centres also. I've focused my talk on 4 key areas this afternoon. Firstly, I'm just going to provide you with some context around the regulatory framework under which we work and the sector that we regulate at the moment. I'm going to talk about residents' rights and what residents have told us about their rights. Our approach in HIQA to a human rights-based approach. And also then I'm going to finally pose some questions for the future. I don't have the answers to those questions, but I'll leave you with them. As the Chief Inspector of Social Services, I'm responsible for the registration and inspection of residential care in Ireland. And that includes centres for people with a disability and older people. By the end of 2021, we had 567 centres for older people. And that had 31,842 registered places. And what that means is that 31,842 older people could live in these nursing homes. We had 1,401 centres for people with a disability, which could accommodate 9,039 people. The vast majority of our older person services can cater for between 41 to 99 beds or registered places, whereas in disability, the vast majority are 1 to 20 registered places. That's quite a stark difference in the type of communal accommodation that we're offering to our older people. The legislative framework is the Health Act 2007, the Care and Welfare and Care and Support Regulations, and they set the minimum standard that is required. And then the national standards, which are set by HIQA but mandated by the Minister, and they set the vision for quality improvement and I suppose challenge providers to move beyond mere compliance. Regulation 9 is the regulation that talks to rights, and it talks about having the freedom to exercise choice, ability to undertake activities, to communicate freely, have access to information, and have different tools and platforms available to communicate. That residents can exercise their civil, political, and religious rights. That they can have access to independent advocacy if they so wish. And it also talks that residents should be consulted with and should participate in the organisation of the centre. And what that really means is that residents have a say about their own homes. Regulation 9 is broad, and it does encompass many of the aspects of a rights-based approach. Our regulatory framework places a duty on providers to respect the rights of people who live in the centres that we regulate and monitor. And it puts a duty on providers in areas such as safeguarding, the use of restraint, visiting, personal belongings, food and nutrition, and the ability to enjoy recreational activities. And related to this is the importance of person-centred care. And this impacts on the quality and safety of those services. And in that way, human rights is not new, nor is it an added extra to the care and provision. The statutory duty placed on providers is already compatible with human rights. It's also important to remember that the regulations, while assessed in their own right, cannot function independently of each other. So for example, if we're looking at residents' rights, like Regulation 9 as I outlined, You cannot look at that without taking into account the environment in which people live. And that requires then to look at the regulation on premises. Equally, you cannot view rights in isolation of privacy and dignity. Promoting and protecting rights and encouraging residents to be able to exercise their rights requires a holistic approach, not just to meet the requirements of the regulations, but to actually improve the lived experience of people living in these centres. As a regulator, we can be really effective in promoting, protecting and respecting the rights of residents. And we can do this by calling out practices which can impinge on the rights of people. As a systems regulator, we can focus on the systems and processes that providers have in place that may not be rights focused. Our inspection and regulatory approaches and the actions that providers take can improve the processes and systems in place. And by improving those, we can improve the outcomes for residents. And that therefore improves their quality of life. When an older person enters into residential care, or when a person with a disability ages, they don't give up their rights. But their rights might be impacted by that decision to move into residential care. So for example, the right to privacy may be impacted because a lot of our residential care services still have shared rooms. The activities programme may be generic and not focused on the individual personal preferences. And as Amanda said, we all saw the impact of restricted visiting during COVID on our older population. Therefore, it's imperative on all of us who work in social services to work towards protecting and respecting the rights of people. But I suppose at the heart of what I'm talking about today is the people that live in services. So I thought maybe you'd like to hear from them.
When asked what a home meant to them, residents told us they were happy they had their own space and did not have to share with a lot of people.
To feel safe and sound. Everything. To be honest, in our previous home, we didn't have our own living room. We used to share a room with others.
And had told us of their delight at being able to make their bedroom their own in their new home.
I chose my room colours in my house. I painted Liverpool colours in my room.
Residents told us about what it's like to live in a campus-based centre.
Sometimes they won't listen to me. I might get into trouble, but I want to go for a pint of Guinness.
One resident told us of their previous home where they had shared a bedroom with 21 other people. They were happy with their new home and they had recently bought their first TV for their new bedroom. Another resident was very happy in their home and stated that they would never go back to their old home.
You could live with a load of people and you wouldn't know who some of them were. Much better in a smaller house.
Residents were aware of their rights and what they were entitled to.
Residents told inspectors that staff were friendly, kind and caring. One resident spoke of how staff had filled the gap when visiting restrictions were put in place and that they could chat comfortably to anyone working in the centre regardless of their role.
The residents confirmed that their choices were respected and their privacy was maintained. Several residents said they would like more social activities as they felt the day was long and they were often bored. Residents' decisions not to participate in activities were respected and alternative activity of choice made available. Some residents spoken with were not involved in activities and said that that was their own choice and that they would rather spend time in their own rooms.
The inspector saw that the centre had residents' committee and residents said that their views were listened to and their rights respected. Records of residents' meetings show that issues and suggestions made by the residents were acted on.
Relatives did comment that it would be better if there were less residents in each bedroom. They commented on the lack of space in the bedroom for visitors, particularly when a number of family members visited together. Residents in single and multi-occupancy rooms were encouraged to personalise their bedroom space with pictures and photographs to reflect their life, their hobbies and interests. Some residents said they chose to live in the centre because it was close to their home in the community and it was convenient for their friends to visit. So as an organisation, we in HIQA are committed to a human rights-based approach. We have refocused our values to put a specific focus on promoting the rights of people. It's been recognised that there's widespread lack of knowledge and understanding of how to apply human rights by people who use services and by the services themselves. We know that internationally recognised frameworks have been found beneficial in implementing a human rights-based approach. And we have produced guidance in HIQA on the FRIDA framework. And as Amanda outlined, that framework is based on the principles of fairness, respect, equality, dignity and autonomy. And by the end of 2021, 46,000 modules had been engaged with in terms of people completing the 4 modules on human rights. We have also invested in training for our own inspectors to further embed our human rights-based approach in our inspection methodology. And embedding human rights in our inspection methodology will ensure that the resident's voice continues to be at the heart of our methodology and our reports, that we describe what it's like to live in a residential centre and how this impacts on people's rights and their lived experiences, that we continue to raise awareness and understanding of a human rights-based approach, to empower inspectors to initiate conversations around human rights with providers and staff, that we inform providers and staff about what they are doing well from a rights-based perspective, and we publish those reports so that other providers can learn. But we will also call out practices that we think are not promoting people's rights. So, to the future. And when we think about residential care in the future, what do we want those services to be? Do we want them where rights are automatic? If the answer to that question is yes, then how do we inbuild a human rights-based approach to the planning and building of those services into the future? How do we ensure that we're not ageist or paternalistic in our attitudes and thinking of older people? How do we have true and meaningful engagement and participation of older people in their care? And how do we genuinely support and empower older people to exercise and enjoy the same rights that you and I enjoy? What do we want our future models of care to look like? Because those services of the future are the services that we will be using. So to finish up, I'm going to leave the last word to the residents.
Residents explained what rights meant to them.
Rights are about speaking up for people and to make a difference, to have a voice for all. Having independence. I have the right to be treated with respect, the right to my opinions, the right to my own spaces, and to treat people how I would like to be treated.